Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Neurocysticercosis. Right. In neurocysticercosis, the most common, the most in neurocysticercosis, if you were asked what is the most common central nervous system parasitic infection, the most common central nervous system parasitic infection is neurocysticercosis. And if you were asked what is the most common presentation of neurocysticercosis, it is seizures is the most common presentation of neurocysticercosis. In neurocysticercosis, the presentation or the clinical features or presentation will mainly depend on two things. The presentation of neurocysticercosis will depend on the intensity of the infestation, or it is dependent on the localization of cysticerci larva, or it is also dependent on degree of inflammatory reaction. So neurocysticercosis presentation will depend on intensity of infestation, localization of cysticerci, and degree of inflammatory reaction. Then cysticercosis, what is the causative organism? The causative organism of neurocysticercosis, as we all know, it is a larval stage of Taenia solium. Like the larval stage of Taenia solium is called as Cysticercus cellulose of Taenia solium, will result in neurocysticercosis.
thank you and thank you for watching.